We are now live. You're looking live. This is Beyond the Race podcast starring yours truly, Dr. Jason Hayes, Democratic candidate for Lieutenant Governor right here in the great state of Georgia. So I want to do something different. This is pre-election. We are essentially running. We are making sure that we're doing some great things here in Georgia. So this is a pre-election question and answer session. Essentially, with this, what we're going to do is we're going to give all of you, the viewers, the voters of Georgia, an opportunity to ask me questions. Questions about who I am, where I'm from, why I am running for a statewide position, and why lieutenant governor. Why not House District 49 state rep? What's the true meaning of your run for lieutenant governor right here in Georgia, and what can you do for people? So we're going to give everyone every opportunity to ask questions. I'm going to look at everything now on the screen while people are asking questions. So you're going to see me periodically look at the screen back and forth to see what questions are being asked by people. And we're going to continue to do some great things. So let me kind of get this prepped up and ready to go. And we're going to look for comments from individuals and see what's ready and what is good. So while I'm here, I'm going to just go ahead and just speak freely. Again, my name is Dr. Jason Hayes, Democratic candidate for Lieutenant Governor right here in the great state of Georgia. And we are on Beyond the Race. And so one thing about me, I tell people I'm originally from Louisiana. My family actually moved to New Jersey before I was born. That's my mom and dad. My dad followed my uncle. That's my paternal granduncle to New Jersey. That's Trenton. And mom and dad hey, hello, how you doing, Miss Hawkins? Mom and dad essentially had my brother and sister in Trenton. Then they moved to Willingboro where they had me. And we were there for about 10 years. Moved back to Louisiana. At that time, mom and dad ended up divorcing. So I grew up with my maternal grandmother and mom at my maternal grandmother's home, and learned a lot from my grandparents, including my paternal grandparents, who we visited a lot. Paternal grandfather was a ex-military, retired military Army guy. He was Master Drill Sergeant. He taught education and he retired from that. And my paternal grandmother, she taught 40 years in the St. Andrew Parish school system. My dad, again, was a retired, he was a Navy veteran. And also my mother is a nurse. And even my paternal grandparents, my grandfather at the time had passed away, but he was a small business owner, mechanic, had his own shop. And my maternal grandmother, who I love very dearly, was a homemaker. So school, did really well in school. At the age of 13, decided I wanted to become a doctor, wanted to help people. And a lot of that was brought upon because I had a lot of family members who were sick. I speak very openly about my brother who had epilepsy. I also had an uncle who had Down syndrome. Even my maternal grandmother, she actually had chronic obstructive pulmonary disease, really bad osteoporosis, rheumatoid arthritis, and I had a host of other family members who was ill. But, I took the cue from my mother, who was a patient advocate for all of her family members, her mother, her brother, who's my uncle with Down syndrome, patient advocate for her sisters, nieces, nephews, and everyone, including my brother and myself as well. So decided to go into medicine. And what I tell people is that I actually had an opportunity at the age of 17 to go to something called Boy State. And the American Legion program sponsors Boy State and Girl State. They sponsored in every 50 states here in the United States. And it was an opportunity for me to actually learn about city, parish, or county government and state government. So great opportunity at the time. I essentially learned, and actually in my universe had a state rep position. And what I tell people is that that was the beginning where I learned about politics and how my voice, my ability to rally people together was actually seen. So from there, went back, graduated high school, top of my class, actually tied for third, but all of us had the same GPA. There was just a matrix involved in which I ended up becoming third. But Essentially top of the class, scholarship to Xavier University in New Orleans, historically Black college. There at Xavier, met a lot of great students, people, got exposed to volunteer and actually did a lot of volunteering with mobilization at Xavier, which is called Max. Kimberly Reese, shout out to her. She's currently with the alumni, National Alumni Office with Xavier, and she does a lot of great things with getting Xavier support, volunteer or scholarships. But her program that she worked with at Xavier was what exposed me to volunteering, and that gave me an opportunity to give back to the community around New Orleans. And I even had an opportunity to do more volunteering with a program called Xavier Family Life Center, where we learned about teaching violence prevention. So we would go to boys' homes in New Orleans. We would teach about violence prevention. We would work with students in high school. So that was, for me, that was a great opportunity. It was something that became a foundation, especially when you're looking to go into public service, when you're looking to go into office. You have to have a desire and a will to help people. So I was so blessed, graduated from Xavier, actually fall of 1998, but the class was 99. So I ended up going to Meharry Medical College, and very blessed to go there, another historically Black college. So to go from Xavier University in New Orleans, one HBCU, to a second HBCU at Meharry Medical College was a blessing. And I tell people all the time, I said, Xavier and Meharry chose me. So to go there, to meet people who I consider friends, and just to meet some great people. For example, the dean that we had there, one of our deans, vice chair, Dr. Pamela Williams. I mean, she did a lot of great things for myself, a lot of my friends. I was able to not only study to get a medical degree, but also a master's in public health. Had an opportunity to do an internship with Congressman Jim Cooper, who was a Democrat in Nashville. My surgical chair, Dr. Stephen Stain, was one of his supporters, donors. So had an opportunity to do a 1-month internship with a congressperson, which was unheard of for someone in medical school at the time. And that was tremendous. Even did an internship. The Minority Health Professions Foundation is a program in conjunction with the Centers for Disease Control. I actually was able to do a 1-year a 3-month internship in the epidemiology division at the Centers for Disease Control. So I had an opportunity to interact with EIS, as the Epidemiology Intelligence Service. Those doctors had an opportunity to see that. So I had a lot of great things that I was able to do in medical school, and did very well in medical school. Graduated, and then 2004, then moved on to Baylor College of Medicine in Houston, Texas. Now, if you know Houston, you know Baylor, you know the University of Texas. That's the Texas Medical Center. They're the best. So the opportunity to go to a world-class referral center, I was able to learn cardiology, gastroenterology, pulmonary, rheumatology at some of the best hospitals in the world. We're talking about Methodist Hospital. We're talking about St. Luke's. We're talking about the largest VA in the country, Michael DeBakey. Ben Taub, that's another one of our county hospitals in that system, Harris County system. So learned a lot, learned from some great minds, and definitely excited. And from there, I became board certified. And then I worked with the National Health Service Corps. So people are like, well, what, Dr. Hayes, what is that? So the National Health Service Corps was started in 1972, along with the advent of federally qualified health centers. So these programs were started to get doctors in underserved communities, rural and underserved. So from 2007, 2011, I was able to do that in Jackson, Tennessee, rural underserved community, Memphis, Tennessee, Nashville, Tennessee, and also was an interim medical director in Memphis as well for a couple months, and had an opportunity experience to see the administrative side. So helping people in that situation, patients who are on our TennCare, that's our Medicaid waiver program in Tennessee, Medicare, uninsured patients, some migrant workers, a few, and then also individuals who were recently released from prison. So we had an opportunity to take care of people. And that's where I saw an opportunity to help people to be their representation at that particular level. So while I was there in Tennessee, I actually had an opportunity to do some work with the American College of Physicians. I was actually on their executive board at the Tennessee chapter. We would travel to Washington once a year, where we actually advocated for patients, Medicare patients, and we advocated for the physicians who took care of them so they can improve the reimbursement structure and rate. And we were successful with that. In addition, I had an opportunity to be a health policy expert, uh, advising the state of Tennessee. The project was called Adult Oral Healthcare, and actually I was a subcommittee chairman for one of the for programmatic options. So that was a great experience to do that in Tennessee, and also became a fellow of the American College of Physicians. I tell people all the time the American College of Physicians is the second largest physician organization in the United States, and we advocate for patients as internists. And to become a fellow, that means you're highest in academic ethics. You're one of the better physicians here in the country. So did a lot. So when I finished the National Health Service Corps in 2011, I ended up being a travel doctor. We call locum. So did some travel work. Actually, even came to Georgia. Worked in Lithonia with AIDS Healthcare Foundation. Learned a lot about programs here with the HIV population. ADAP, that's the program. It's sort of like an insurance, but it's helps to get funds to individuals who are living with HIV. Help them to see the doctor. We also help them to get their medications, lab work, critical lab work. So was able to do that. Still did some more traveling, and then came and got recruited to the Alpharetta area through a healthcare system, and have been in Alpharetta since late 2014 ever since. Worked with this healthcare system for about 2 years, and then ended up actually going and getting a physician's executive MBA while being a travel doctor at the same time. So I ended up getting a physician's executive MBA where I actually learned how to do some great things, such as healthcare economics, budgeting, things that are tremendous that you need to know, and also small business ownership, how to do a business plan, things that are needed for individuals when you're trying to start a business. And while I was doing that, I actually, again, I mentioned was traveling. So I actually ended up working in Middle Georgia with community health systems, and I worked in Warrenton, uh, traveled around Sparta, some nice towns, Macon as well. So I had an opportunity to learn Middle Georgia as well, and that was a great opportunity. Did that for about 4 months, and then once that was done, I was able to get my business up and going. That's Personal Concierge MD, my own small business. So just like a lot of us small business owner, you go through growing pains, and so I was able to experience the pandemic with COVID-19 not only as a doctor, but as a small business owner. So dealt with the PPP and dealt with the EIDL. So had experiences that many other didn't, and also dealing with COVID-19. Even though I was somewhat in a situation whereas I didn't have as much exposure as a lot of my colleagues did, who worked in the ICUs and the ER. But even in my own practice, I had to learn to pivot. Did a lot of telemedicine, and the patients that were brought in, we still had to wear our mask and everything, make sure that we were protected from COVID-19. So been through a lot. Even family members got sick. My own brother almost died from COVID-19. So even during that time back in 2020, I ran for office, almost didn't when my brother got sick, but still ran for state rep in Alpharetta / Johns Creek, and had a primary, won it at 54%. And then I ended up almost flipping a Republican district. That's House District 49, which is in 6th Congressional District, which is Republican. That's Newt Gingrich's old district. And I got 47.2% of the vote, which was huge for a first-time Republican candidate. And I'll say this very clearly, Black candidate, Black man in a district that is 62% white. So what it showed everyone, that not only I was a great candidate for Democrats, but also a candidate that Republicans respect. So the question I get all the time is, Dr. Hayes, why didn't you run for House District 49 again in 2020? And I tell people, Alpharetta is going to be fine. We have CEOs here, doctors, lawyers. We have a lot of self-made small business owners. They're going to do well. But my concern was Georgia. We're ranked 43rd in healthcare. We have counties in the south of Georgia where there are no OBGYNs, pediatricians, internists. We have a lot of hospitals that are closing. And the pandemic, I say it all the time, exposed our healthcare system here. We're talking about minority communities where healthcare disparities occurred. When we say healthcare disparities, that's racism in healthcare, or we say inequities. Something I learned at Meharry Medical College, where we studied what we call healthcare inequalities. And so we have to look at what's going on here in Georgia, what we can do to help improve. And then also poverty. South of Georgia, and also pockets of in Atlanta and Columbus and Augusta. We have a lot of poverty-stricken communities. So what I looked at is an opportunity for someone like myself, who had a tremendous amount of training as not only as an internist, a primary care doctor, board certified, but also a public health specialist, someone who's also has an executive MBA, who studied healthcare systems, economics, budgeting. I have a great opportunity to help people here in Georgia. And what I tell people is that we have 4 things that we need to fix here. Number one is healthcare. And and one thing that I want to do is utilize the federally qualified health centers to get them to the underserved communities. So people say, well, Dr. Hayes, how do you do it? Here in Georgia, we have something called medical underserved areas. And we correlate that to health profession shortage areas. Basically, we figure out using census tract data to figure out the number of people, that is demographics, socioeconomic status, and also the number of full-time equivalents as physicians to the people in a census tract area. We look at that, and through this calculation of medical underserved areas, we correlate that to the health profession shortage area with the federal government. That's HRSA, Human Resources Services Administration. Communities can apply for Public Health Service Grant Section 330 to get federally qualified health centers built. We get them built in south of Georgia, in Albany, more in an Atlanta, in Augusta, in a Savannah, a Midland, a Warner Robins, Macon, communities that need them, Valdosta. We need to get this done, and I can help facilitate that from the lieutenant governor's position. In addition, you get the federally qualified health centers, you can recruit the doctors, the OBGYNs, the psychiatrists, the pediatricians, the internists, the family practice doctors. We get these healthcare practitioners along with the mid-levels, physicians assistants, nurse practitioners. We can close that gap along with Medicaid expansion. Now, this is going to be tough, trying to get people with a Republican-led state Senate and also a Republican-led House. And depending upon who's the governor, it could be a Stacey Abrams as our Democratic governor. It could be Brian Kemp or David Perdue. So you're going to need a lieutenant governor, someone who has the ability to work with people from both sides of the aisle, but also the ability to bring firsthand experience at what Medicaid is and how to get the doctors to areas of need. So if we can do this, we can help close the healthcare gap. But in the event we can't get Medicaid expansion, I have the ability to pivot, at least help a governor or state Senate or state House pivot. If we can't get Medicaid expansion, which is what I'm pushing for, because Medicaid expansion will help draw down those Medicaid federal funds, which will help amplify what we call DISH. That's DISH money that goes towards, that's disproportionate state funding to go to these hospitals. That Medicaid expansion would help amplify those dollars to help keep those hospitals open. But in the event we can't get that because it's blocked by a Republican legislature and a Republican governor, then we got to pivot to a Medicaid waiver program. Well, I've studied the Medicaid waiver programs Whenever I was in medical school, when I studied for my master's in public health, I actually did a paper on the TennCare program, which is a Medicaid waiver program in Tennessee. So I understand how these programs work. And when we do this, whether if it's Medicaid expansion or a Medicaid waiver, regardless of what we do, we have to increase the reimbursement rate so that doctors will have the ability to see the patients. Now, people are saying, well, Dr. Hayes, how do you know this? Well, I'm a Georgia Medicaid doctor myself, and it is hard to see Medicaid patients because the reimbursement rate is very low. So there are doctors I've talked to in the campaign trail who would love to see Medicaid patients and do their part. But if we don't raise that reimbursement rate, it is going to be harder for doctors to see the patients. It'll be harder for the healthcare systems to see the patients as well. So whether it's Medicaid expansion or a Medicaid waiver, we've got to raise the reimbursement rate. Two, we've got to make sure that we negotiate deals with healthcare systems and also with doctors as well to get them credentialed, that is to sign up. So we have to start recruiting more doctors in healthcare systems and retaining them in addition to raising that reimbursement rate. Because when people get the Medicaid or the Medicaid waiver program, they got to have doctors to see. They got to have their OBs to see. They have to have their pediatricians. They have to have their internists to see. Because the last thing that we want to do is give people health insurance or have them with affordable health insurance and their blood pressure is still under control. Well, that can lead to strokes and heart attacks. Their blood sugar or diabetes is under control. That can lead to strokes and heart attacks and kidney disease. That's the last thing you want to have happen. People show up to your emergency room sick and almost dying. So we have got to make sure that we have the doctors in place, the healthcare systems ready to go, so we can actually have preventive care going, cancer, preventing breast cancer, colon cancer, skin cancer, all of these cancers that we need to prevent, prostate cancer. So what candidate would be best suited to be the conduit between the governor, the state house, state senate, and the American people of Georgia? I tell everyone all the time, I'd be that de facto medical director to make sure that we make Georgia healthy and we can reduce maternal mortality. And there's other things that we can do too as well. We need to look at getting a medical school in the south of Georgia. We need to look at we get residency programs in the south of Georgia as well. So these are a lot of things we can do. Number two, there's education. We have got to make sure that educators get better pay. And also we get them the support in the classroom. The last thing that we want to do is recruit and retain our teachers, but yet we're still dealing with issues in the classroom with students coming from disadvantaged situations. So we need the clinical social workers in the classroom. Our teachers need teachers' aid. Our teachers do need support in the event some students do come to school and they have some issues. But we also must make sure that we prevent the school to prison pipeline. We must teach emotional intelligence in school. We must remove or take away the burden of teachers labeling our special education students or labeling students who may have ADHD or who may not have ADHD. We have got to have the pediatricians involved, the psychologists, the psychiatrists, the pediatric psychiatrists. We must have the right people in place. So when we look at the budget, that I've learned is that we do have dollars there to help, but we also need to make sure that there are resources available for the state of Georgia. The same way people ask Dr. Hayes, how are we going to pay for Medicaid? How are we going to pay for paying our school teachers? We have got to get revenue here. And one way to get revenue is to raise the tobacco tax that we have here in Georgia. 37 cents, one of the worst in the country. It needs to be raised over $1. I'd be gunning for $1.50. When we do this, we generate revenue, but also indirectly, we get people to cut down and hopefully stop smoking. Other things we got to look at. We got to look at bringing revenue. Some people may not like this idea, but gambling. Many of Georgians, we're already playing the lottery. So why not have horse racing? Why not have casinos? Why not have these opportunities to generate revenue? And what I tell people is that it's not just the winnings or the dollars from that, but it's economic growth. If you have a casino that's being built or a racetrack, when you do that, guess what? People are going to travel to these facilities. And when they do, they're going to need a place to stay, hotels. They want a place to eat, restaurant. People being recruited to work there, those are jobs. They're going to need a place to live, apartments, homes. People need to shop, shopping centers. So when you look at these things, this is revenue generation, is growth in the community, and it's also more dollars to help improve your communities. Now, I get it. Some people may not like the gambling idea, but these are opportunities at revenue and that we have to look at. So when you have those revenue dollars, you can help pay your school teachers. You can help improve the schools as well. Now, the QBE formula that we talk about, and some people say, well, Dr. Hayes, what's the QBE formula? The QBE formula was in 1985, and that's quality basic education. And basically what happens is that the state legislature decides the value of each particular student each year. Last check in 2019, it was $2,600. So they have to check in each school system, have to check or do a count on the number of students that come to school. And that's twice a year they do that check. So when they do that, the dollars that go towards the school will help fund, school teachers and the facilities as well. But, with the QBE, again, that's about $2,600 per student. It's counted twice. And then there's also, so those are those dollars, and that's times the local fair share. And when we talk about local fair share, that's property taxes. So what's supposed to happen is that if you're in an area like in Alpharetta, the dollars that you get from the state essentially goes down as your property taxes are up. So if you have a pretty much a higher amount of property taxes, you're in a nice district, then you have more funding from a fair share perspective, but your dollars from the state is supposed to go down. It's supposed to balance. But if you're in an inner city Atlanta where the property taxes aren't exactly the same, so your local fair share is lower, your amount of dollars from the state is supposed to go up. Now, the issue that we're trying to figure out is that why aren't these dollars going into the communities that need them? So that's the concern that a lot of us have. Where's the dollars going? Well, some of those dollars are being rerouted to charter schools. Some of them are being rerouted to private schools. Now, we can't have that. What I mean by that is that private schools operate in the manner that they operate. They get their dollars from the tuition. So, in charter schools as well. So we have got to figure out how to make education equitable, especially for those who are in rural communities and underserved communities. Now, it's to my understanding that Georgia is not drawing down on some federal funds that they could draw down on from the Department of Education. So that needs to be fixed as well. So someone like myself, I understand budgeting. I have an executive MBA. We need to start looking at a new formula to how we fund our schools. And also in the interim, that will be the long-term fix. But in the interim, in the short term, we need to start utilizing whatever dollars that we have in addition to looking at other revenue sources. I tell people this all the time. When you're looking at the budget for the state, at least half of your budget is coming from personal taxes. We pay more personal taxes for the state of Georgia for revenue than corporations do. Now, when I get to my economic growth plan, we'll talk more about that. But one thing that I want to do as a lieutenant governor is that I really would like to develop an education committee. I want representation from every school in the state of Georgia. And I want the school teachers, the educators, the administrators in a position where they can educate the public servants, the politicians on what needs to be done. And one of the things that I definitely want to see is the curriculum improved, and also ideas on how to get better pay, ideas on how to get better support for our school teachers, recruiting and retaining them as well. Like I told the GAE that we want to make sure that we give you a canvas, and this canvas will allow for you to say, hey, doc, this is what we need to do to help students. And I don't know if a lot of you are aware, but Georgia actually has passed an act to make sure that the students in high school do learn about financial literacy. And that's a great start. But we also need to start teaching small business ownership. We've got to teach about the business plan. We have got to also bring back trade skill opportunities and still continue to fund STEM, that's science, technology, uh, engineering, and math for those who want to go to college. But those who don't want to go to college, we got to give them skills. Young people are vulnerable, especially those in underserved communities and rural communities. They're vulnerable to gangs. They're vulnerable to uh, homelessness, poverty. We've got to put them in a position whereas when they graduate from high school, that they can start working, whether if it's doing HVAC, electrical work, whether if it's they learn how to cook, become a chef, or if they learn how to do carpentry work, construction, things that can be used to help their community. So we can negotiate with even corporations. I'm going to talk more about this in my economic growth plan, but we can get corporations like a Home Depot or Lowe's to invest, in some of these trade skill programs. We can help young people, other technical skills, medical assistant, some nursing, phlebotomy, things that can be useful for young people to get skills. So we need our educators involved. Thus, one of the first things I want to do as Lieutenant Governor is to commission a committee for such, so we can help. Next thing we want to talk about is economic growth. So I tell people this all the time, economic growth. Economic growth is critical. It's important. It's important in improving infrastructure in communities. It decreases crime and improves property values. It helps communities become better. I live here in Alpharetta, and I'm not bashful about telling people this. Here in Alpharetta, I see small business ownership all the time, and I see people doing well. So we must push for a Georgia level small business association. I talked about in high school, teaching young people about the business plan. Well, we need to teach people the business plan, those who are outside of high school, teach them how to do a business plan, how to get debt finance, that is, financing from the bank, and also how to keep your business running, how to make it profitable, and then what to do in the event there's a catastrophe like a pandemic. We need this. We can get retired accountants, retired marketers, or even work with people. Uh, I would be open to maybe having a payback program for those who are accountants and marketers, small business owners, to help them pay off their school loans or their debt, to give time with the Georgia Small Business Association. We do this. We help people get better, stronger. We help communities get better, stronger, infrastructure better, decreasing crime. We can have self-reliance in our communities, but we have got to push for this. Again, I mentioned before, corporations, we as people here in Georgia pay more taxes than corporations. So people may not want to hear this, but we've got to tax those C Corps. Got to tax them. Now, people will say, well, Dr. Hayes, we tax the corporations. Will they want to come here to Georgia? Here's the beauty of this. We offer them tax breaks so they can come to our rural communities and underserved communities in urban populations and look to invest. Community job hiring, community job training. I talked to someone earlier today about an idea that I have that we can negotiate with Amazon. Amazon can come into our communities and some of these dilapidated buildings or some old warehouses. They could put up their warehouses. Also, Amazon, guess what? They own Whole Foods. We can get them to come into our communities, have a Whole Foods there, community job hiring and training. Now, the question comes into place, Dr. Hayes, the foods there are expensive. Yes, they are. We work with them on offering people who may not can afford it, Prime card. People say, well, Dr. Hayes, the Prime card, what's people are aware when you're dealing with Amazon, there's a Prime card that you can get and you can get a lot of discounts. Well, we offer the Prime card to people who are low income. You would know who has the Prime card because they're low income or not. We can give them discounts on foods. And also, we can encourage small business owners who have products. We can have them use Whole Foods to sell their products there as well. It's a great opportunity for young people outside of high school to have work during the summer and after school. And also, even when they graduate, they have a place to go where they can work. That's an opportunity where we can cure food deserts and bring jobs to communities of need. And guess what? When we do that, Whole Foods becomes an anchor. Those of us who know real estate, commercial real estate, know about anchors. That anchor tenant will help bring other tenants around. That's right. The gas stations, also bringing in, you know, other shops and restaurants, dry cleaning. It all works together. We can do great things here in Georgia, but we have to have individuals or innovative individuals who want to do great things. And again, we can commission a committee on economic growth and how we can improve communities in the south of Georgia, Albany, Tifton, Valdosta, Waycross, Hinesville, Hinesville, Statesboro, Macon, Dublin, Sparta, Sandersville, Moultrie, Rome, Gainesville, communities that we can help. We could do some great things for Georgians, but we're going to need people who are forward thinking. And again, I mentioned before how we can look at other ways for revenue. Hey, we can look at the casinos. We can look at the horse racing, the gambling. Those things can help generate revenue. And last but not least, voter access, voter protections. My campaign, we partnered up with Ride Share to Vote. You can go to rideshare2vote.com and you can actually call an 800 number where you can get free rides to the polls. But the truth of the matter is that it shouldn't even be like this. The truth is, SB 202, first thing I would do, or one of the first things I would do as lieutenant governor is we got to make sure that that's repealed. The voter law, voter ID law, I get what people are saying. It shouldn't be a problem to have a voter ID, but we can't use it to intimidate people. We must allow people the opportunity to vote same day, sign up to vote same day, make voting a holiday. Even I had an issue trying to vote. I had to actually leave one of my contract jobs or turn it down for a day so I can go vote. So we've got to make sure that we put every opportunity for people to vote. And we've got to get Republicans on board with this as well. Shift workers, working a mill, work for factories, hospitals, ERs. We got to put them in a position where they can put their vote in the ballot box. It's watched under supervision. People can mail their ballots. We've got to make sure we do that. Cybersecurity as well. We've got to start looking at ways so we can start voting online, signing up to vote online. If we can do MVP.sos to figure out your precinct to go vote to, you should be able to sign up to vote on there. You should be able to vote as well. So we've got to start being forward thinking here in Georgia. And Republicans who are here, we are individuals who have issues with voting. We have got to let you know that we're all on the same page with doing everything right about voting. But let's be very clear about this. Using people who are immigrants who may not be citizens here as a reason as to why Democrats are winning elections. That's wrong. People who are in the immigrant community want to become citizens. They would love to become citizens, but they know full well if they try to vote that they can be arrested, detained, and ICE can be called and they can be deported. So they wouldn't do that. So we've got to start moving forward with this as well. I do want to backtrack to the healthcare situation with abortion. I did talk about this in Beyond the Race is Abortion Care, Healthcare. Actually, I had a discussion with someone today about abortion. And, at the end of the day, I'm Catholic. I grew up in Louisiana. And essentially, uh, growing up in Louisiana, it doesn't matter if you're black or white, if you're Catholic, and we just don't believe in abortion there. But for myself as a doctor, the science, if a woman has an ectopic pregnancy, that's an abnormal pregnancy, that's outside the womb or the uterus, you may need an abortion. Matter of fact, not may, you will need an abortion, terminate that pregnancy in order to live, because the ectopic pregnancy can harm the mother, can kill the mother. Rape, incest. What if you're mentally incapacitated and there's incest or rape? Those options should be there. Car accident. There are situations where the OB has to make the emergent OB or the OB that's involved, that's on call in the ER with the ER doctor, they have to make a decision. Save the life of the mother versus the fetus. So there are times when abortion is needed. So I stand by the American College of Obstetrics and Gynecology that abortion care is women's health care. And also at the end of the day, I can't tell a woman what to do with their body. So in the event if Roe versus Wade is struck down, I will work very diligently and be very assertive about putting together what I would like to call a Women's Reproductive Health Freedoms Committee, where we get the abortionists, the OBGYNs, the pediatricians, the neonatologists, the social workers. We have to decide when an abortion is appropriate or not. Now, the fetal heart bill is wrong because sometimes women don't know when they're pregnant. 6 weeks is too early. That's electrical activity of the fetus. That's all that is. They say fetal heartbeat, electrical activities is what I'm saying. So a woman may not know, because women can actually not have a period through conditions like polycystic ovarian syndrome, thyroid disease, hyperthyroid, hypothyroidism, Cushing's. A lot of endocrinology type conditions can cause a woman to miss their period. A pituitary situation, pituitary deficiency, infarct. There are a lot of things that can cause a woman to miss their period. So we cannot tell a woman in a lot of ways that, hey, at 6 weeks, you can't abort. So those are things that we just can't have. And also we cannot have outlaw abortion at conception. There's one state where some lawmakers trying to do that, so that's wrong. But what I do agree with is making sure we come up with a consensus. Now, initially 22 weeks was chosen because of the surfactant. That's a material that is secreted. It keeps the alveoli, that's the tiny air sacs in the lungs, open. So at 22 weeks, this is when this happens. So this is when they've chosen for it to as the cutoff. But the argument is, what about at 20 weeks? Because we give steroids, or OBGYNs and the pediatricians and neonatologists, they give steroids to the fetus that's born early to help with the production of surfactant. So is 20 weeks okay for a fetus? Is 18 weeks? Now, that's not my expertise, but I would want to have the experts involved so we can come up with a consensus in terms of when to have an abortion and when not. But regardless of the decision that we make, we must make sure that we fortify and improve adoption. We must make sure that we improve the foster care system, because there are children that are being abused in the system, being neglected, and we must protect them as well. So Uh, I want the experts involved. I want the right people to make the right decisions so we can come to a consensus. But at the end of the day, we have got to protect women's right to choose, and we've got to protect women from falling victim to population control. Meaning, there was a time that Black women and those of us who are Native were subjected to hysterectomies. They were subjected to tubal ligation, that's tubes tied, and they didn't know it. So when we talk about women's reproductive freedoms, that should also and will also include what if they want to have an abortion within the right time frame, and also protecting them from hysterectomies and tubal ligations that are done without their knowledge. I like for people to look that up. So I have discussed, what I would like to do as lieutenant governor, why I'm running. Do want to talk about the job. Now, as lieutenant governor, you are number two, the executive branch behind the governor. You have your own budget as well to manage, which is about $1.5 million. And again, you're the president of the Senate. You can cast tie-breaking votes, and also you have the ability to reroute certain bills to a committee where you can kill them. For example, SB 202, which is the voter suppression law. If I was lieutenant governor, I could have taken it and sent it to a committee where we essentially could have killed it. And also, again, commission committees, you can study things like, in my case, economic growth, education, looking at the abortion situation. So there are a lot of things that you can do. And also, you can still advocate for people from the position. So I feel very confident. I feel like there's support there. And I feel like we can do some great things here for Georgians. Because what I tell people is this: I'm here for people, not the party. So if I have to stand up to a Republican, I'll do it. If I have to stand up to a Democrat, I'll do it. And it's also important that the lieutenant governor is someone that has the ability to work with both Republicans and Democrats. So out of all the candidates, I'm the only one, in my opinion, that has that skill set. I live with Republicans. I work with them. I have the respect of Republicans, and also have the respect of Democrats as well. So we got to do some great things here for Georgians. So I'm going to go ahead and look here on Facebook, see if there are any questions from people. I'm looking for some comments. See if there's anything as well. And I see some likes. I appreciate the likes. So we've been going on for about 48 minutes. I know I this was kind of quick that I put out this live podcast. So hopefully, people will, have the opportunity to still ask questions. I'll stay on for another few minutes. If we don't, I'll close, and then we'll replay this so people can actually listen to me and listen to, my last stance running as the Democratic candidate for lieutenant governor here in Georgia. So, but yeah, we can do some great things for Georgians. And, Georgia is a, awesome state. So yeah, we'll wait a few minutes, and we get a couple of likes here and there. And we'll wait another minute or so. Not seeing any comments. So yeah, what I'll do is we will replay this. We'll keep it actually on Facebook. We'll also keep it on YouTube as well. And also we'll have it on Apple and Spotify. And what I'll do is I'll periodically look at Facebook, YouTube as well, and see if anyone has any questions. I'll answer them. And also I got something as well. We have some digital billboards out and about in Atlanta. And what I've told people is that if you can find the location of the digital billboards, DM me at Jason for Georgia on Instagram, at Jason for Georgia on Facebook, and we'll send you That's right. We will send you a button. Dr. Jason Hayes for Lieutenant Governor button. So I want everyone to get ready to vote tomorrow from 7 a.m. to 7 p.m. Go to the Georgia Secretary of State website um, and just Google it. And if you have any questions about your voter location, please go to the Georgia Secretary of State website and you can enter in your name, your last name, your date of birth, and it'll tell you where to go vote. Look for Dr. Jason Hayes under Lieutenant Governor, that's Democratic ticket. It'll say Jason T. Hayes. Please choose me. You will not regret it, Georgia. You're going to get someone who's going to fight for you because I'm for you. I'm affiliated with the Democratic Party, but again, I'm here for you. And Republicans, those who are listening, I want you to hear me out as a candidate. If I'm the Democratic candidate nominee for Lieutenant Governor, I want you to hear me out. We may not agree on everything, but we can work together to make Georgia a great place because Georgia is awesome. And we can make Georgia stronger, better. We can make communities self-sufficient. That should always be the goal. Self-sufficiency. Underserved communities in urban areas and rural communities as well. I want to grow the pie. And I want to make Georgia better. And we can do it. So I want everyone to learn about me, Dr. Jason Hayes. Go to www.jasonhayes4forga.com to learn more about me. I'm on Twitter as well at Jason4GA. I'm on Instagram at Jason for Georgia, Facebook at Jason for Georgia. I'm also on TikTok at Jason for Georgia, Snapchat at Jason for Georgia, and LinkedIn at Jason for Georgia. When you go to my website, www.jasonhayes4forga.com, you can go to the tab that says Meet Jason. You'll get my background, who I am, where I'm from, why I'm running for office. You'll also see a section that says Community, all of the communities I've gone to, Athens, Augusta, Savannah, Liberty County, Fort Stewart, Atlanta, great communities. So you have an opportunity to see me with people, how I've interacted. Also, you can go under engagements. You can see me for my debate with Atlanta Press Club. You can also see me in multiple forums. And also when you go to media, you can see TV ads. You can see Georgia's superhero, Dr. Jason Hayes, as well. You can also see my ad for Medicaid expansion. You can also see the multiple radio ads that we have. You know, Dr. Jason Hayes, a two-time HBCU grad, Super Jason Hayes. You can see all of these and just listen as well to the podcast that we have. Actually, it's going to be 8 podcasts as well, from critical race theory to prison industrial complex, education, is abortion care, women's health care, public health crisis, maternal mortality, public health crisis, gun violence. Also one about my background as well. And also, you'll better listen to this episode as well. The pre-election podcast live, Dr. Jason Hayes, Democratic candidate for Lieutenant Governor. So if there aren't any questions, we'll go ahead and close this out. Again, I want to thank all of you for giving me an opportunity to have a platform. I am happy that I was able to run for an office that I wanted to run for. I was able to run the campaign how I wanted. I was the campaign manager. I was the strategist, but I did have help. I had a great compliance team, Mr. Peter Sarason. Also, I have a data team called Sterling, and they're very excellent. Josh, excellent guy, is one of the partners of it. Also, we had a really great digital team as well, that helped us, as Neil. And also we had a host of other teammates on the campaign, and they gave us some great advice on running the campaign, what we're doing. So I thank all of them. I had a great time, learned a lot, did a lot of call time, fundraising. I don't know if people are aware, but I did 20 to 30 hours a week calling supporters across Georgia, getting to know people. And for those who donated to the campaign, whether if you're in Georgia, whether if you're outside of Georgia, whether if you're in my personal network as physicians, family members, I thank all of you because running for office is not easy. It is very grueling. It's hard. And especially someone like myself who still was seeing patients in my practice, still doing my contract work with my hospital systems that I have here. This was a lot. So win, lose, draw. I'm proud of myself, but I'm also proud of you who are involved in the political process, who went as far as donating, who's gone as far as voting for me. At the end of the day, whatever happens on May 24th is going to be God's will. It's going to be God's will. I've learned a lot, and I learned a lot about people, learned a lot about myself. And at the end of the day, this is going to be God's will. Whether if I win this or not, it'll be God's will. At the end of the day, my job, who I am, is to help people. And that's not going to stop. I'm going to continue to be a doctor, and I'm going to continue to be a public servant. And if things don't work out as lieutenant governor, you'll look and see the next step. Maybe in 2 years, maybe in 4 years. But I know the formula now. I know what needs to be done to win this game. And I want to help other people understand the formula to win this game, because we need good people running for office, becoming public servants, not for a party. I said it, not for the party. It's for people. And when you say it like that and you mean it like that, we can do some great things. We can do some great things for Georgia. We can do some great things for the United States. We can do some great things for the world. But we have to be true to self, true to who we are, and make sure we get good candidates from our community elected. We need to be more involved in the political process, and we have got to get good people elected from our communities who represent us. And when we do that, we can change culture. I'm not happy seeing people homeless. I'm not happy seeing people disenfranchised. I'm not happy seeing people that look like me getting shot by police. I'm not happy seeing people that look like me shooting each other, being in gangs, robbing and stealing. I'm not happy with that. I'm not happy seeing communities with people that look like me not self-sufficient. I'm not happy seeing people addicted to drugs, cocaine, crack. I'm not happy seeing people going to jail with marijuana charges that shouldn't be. I'm not happy seeing people addicted to opiates. I'm not happy seeing people with mental health situations, mental health crisis. I'm not happy seeing people dying from COVID. I'm not happy with that. I'm not happy seeing people die from HIV. I'm not happy seeing people attacked for being who they are. I'm not happy seeing Black men being attacked, Black women being attacked, minorities being attacked, women being attacked. I'm not happy with that. That's my why. That's why I'm running for office, and we need more people running for office for those whys. We don't need self-serving people running for office. We don't need hating people or who are hurting other people running for office. We've got to be supportive of each other. We've got to help each other. And we've got to help people rise so we can make this place better. Help young people become leaders. Get them in a position to be successful. That's what we got to do. And help those who are weaker than ourselves. Help the elderly. Don't hurt them. Stop sex trafficking. Stop the slavery that we have here. Make this world equitable for people. That's what we need. Again, I thank all of you for giving me an opportunity to speak to you. This has been a blast. Win, lose, or draw. Again, thank you again. This is Dr. Jason Hayes. I'm your candidate for Lieutenant Governor right here in the great state of Georgia. I thank you again. This is Beyond the Race. I'm your host and executive producer. Thank you again. Godspeed and have a great evening. And don't forget to rock the boat. Thank you.